Now, yesterday we spoke to the Gauteng Health reporter who's exposed the frightening conditions at Lenasia South Hospital. Among these is the lack of water for weeks, ailing infrastructure, and the hospital not being exempt from rolling blackouts. eNCA has tried to contact the Gauteng Health Department for a response, but has not received any comment as yet. Now, to get some reaction on the story, we're joined by the Democratic Alliance's Gauteng Health spokesperson, Jack Bloom. Mr. Bloom, good morning, and thank you very much for your time. As you would have heard there, we have tried in vain to get the response from the Gauteng Health, but it honestly was an article that read like a horror story. To hear that there's no water, there's no electricity, ventilators aren't functioning, people are dying in front of those that are meant to help them, and those hospital staff are helpless. What do you know of the situation in Lenasia Hospital?
Well, I was horrified to read the article, I must be honest, but that hospital has suffered from problems for years. It is in an area that seems to have an unreliable electricity supply, and I do definitely think it should be a high priority hospital to be exempted from the ESCOM cuts. But what I was really most disturbed about was that they ran out of diesel for the generators. I mean, that's absolutely inexcusable because that's within the hospital's control. You know, if there's no water for various reasons, electricity is cut off. I mean, deplorable in itself. And this has been going on for years, actually. Surely you have enough diesel on hand and you should have water storage facilities on this property. I visited Lenasia South Hospital. It was a converted community health center that they've just upgraded to a hospital recently. But it seems they haven't upgraded as much as they should have, because it is now a fully fledged hospital. It's got more patients, and yet they simply can't look after them. And it's really no excuse to run out of diesel and not have alternative arrangements for water. I was just absolutely horrified to see the latest revelations. I have to tell you, it's not the only hospital that's suffering. At Helen Joseph Hospital has also run out of water. We're facing a department in crisis, and patients suffer. And patients in Lenasia South Hospital, I think people have died because of what's going on there.
No, it's honestly heartbreaking. But if I'm getting you correctly, are you attributing or apportioning blame to even the hospital's management itself here? That insofar as your resources were concerned, you should have had some sort of data to say how far you are with your diesel and then start procuring?
Well, I think you could share the blame over a number of authorities, but part of the problem that hospital managers face is that maintenance is done by an entirely separate department. It's called the Infrastructure Development Department, and this is just a hopelessly incompetent and corrupt department. They are responsible for installing the generators, and honestly, they should have sufficient generators, and I do think hospital management should have done whatever they could to have enough diesel. Quite frankly, you can get diesel at a local garage. I mean, if in emergency circumstances, that's what the hospital managers should have done. The fact that patient care was severely compromised because of this, I think is inexcusable. I'd like to see a proper inquiry, but we can't even get the department to respond. As you've said, you've reached out to the department, they're not commenting. I'm afraid this is par for the course. Let me name other hospitals that are suffering terribly. There's so many. But I must say, this latest reporting, I think, shocked me to the core.
But what about the red tape? Because in some instances, you find the hospital management themselves saying that we're equally helpless, because one would think of going and purchasing diesel themselves if they had the funds, but you might find you would have broken some sort of protocol, and in that instance, you're not refunded. But beyond not being refunded, which wouldn't be the problem if you're saving lives, but beyond that, you could be disciplined for having circumvented the process.
Look, I feel sorry for hospital CEOs. Very often it's like trying to run an institution with both hands tied behind your back. I mean, that's really with the red tape and restrictions and the fact that you have to deal with the Infrastructure Development Department. It's really, criminal that this is how people have to operate. But the Gauteng Health Department needs to get a grip on the power situation and the water situation. We've seen this at Rahima Musa Hospital, at Helen Joseph Hospital, now at the Lenasia South Hospital. It seems load shedding and power failures and water shortages are going to be with us for a long time. I actually called some time ago for a water policy and an energy policy, and we don't see it happening. One of the things that they should have speeded up is to have solar panels on the roofs of our hospitals. In fact, they say that's what they're doing. But we don't have time. We've got to cut the red tape. I think, quite frankly, we've got to get the private sector involvement, private-public partnership. The public sector's they just seem not able to do what needs to be done. We've seen this with the Johannesburg Hospital. After that terrible fire, the hospital is still not up and running. The provincial government couldn't even get its act together to fix it, and they had to call in the National Health Department, the Development Bank of South Africa. I think similarly we see with the Lenasia South Hospital that they're just incapable of doing what's necessary. We've got so many good people and organizations that could help. A gift to the givers, I'm sure, could sort it out very soon, but they have to be asked. They have to be allowed to do it. What we saw at Johannesburg Hospital is that there were offers from very worthy organizations, and they weren't allowed to help initially. Only later were they allowed to assist. So I would like to see cutting red tape. I'd like to see hospital managers have enough powers to do what they need to do, but they also need enough resources, and they shouldn't have to suffer if there's a shortage of diesel or the generators don't work. I think people need to understand that even when the generators kick in, it's only enough for emergency operations at the hospital. The hospital can't run on generator power for the amount of time that these Eskom cut-offs last.
So
and
meaning
of course
as a
there were
start,
some.
apologies. So meaning as a start, perhaps they need to be exempt from these rolling blackouts. Just as a start, that would be the
Well,
low-hanging fruit.
absolutely. Yes, absolutely. Look, I asked a question about this. It seems that 19 out of 37 Gauteng public hospitals, that's the majority of hospitals, are still not exempted from the blackout. So I think that's an absolute high priority. But the problem is, as I've said, even if you've got the generators working, the batteries don't last. And to hear stories that doctors have to use cell phone lights and manual ventilation, and you're a patient who's anxious and suffering, and the lights go out, and doctors are, desperately trying to do what they can. Doctors have to make choices. They'll try, if they can only save one patient instead of all the patients, that's what they're going to have to do. I find this terribly tragic, and I find the attitude of the Gauteng Health Department just absolutely deplorable. They're not communicating. They're not telling us what they're doing. This is an emergency situation. I think we should look at the very vulnerable hospitals like Lenasia South Hospital, which is in an area that's prone to blackouts and hot water shortages. Water's absolute hygiene need. I don't know hospitals can not have backup plans for water. Patients couldn't go to the toilets because there was no water and it was backed up. Just think of the infection risks. It's horrific. It's horrific.
And just a thought, because when you're in hospital, perhaps your immune system is already compromised. You don't need to be in an unhygienic environment. It's honestly unbelievable. But we won't stop. We'll try to get the Gauteng Health to speak to us and just give us clarity as to what exactly happened there, what is happening, and what they plan to do. Mr. Bloem, thank you very much, though, for your time this morning. That was Jack Bloem from the Democratic Alliance's Gauteng Health.